As I've said before, we want patients on a good foundational diet, and then we want to supplement that diet with multivitamin, multimineral, sufficient vitamin D, and we also want to make sure that patients are getting the so-called essential fatty acids that they need. These are ALA, EPA, and DHA as the omega-3 fatty acids, and the anti-inflammatory omega-6 fatty acid, GLA. So the more complete scientific names of these fatty acids are alpha-linolenic acid, gamma-linolenic acid, eicosapentaenoic acid, and docosahexaenoic acid. Also oleic acid and phytochemicals and squalene from olive oil. Historical Paleolithic intake of omega-3 fatty acids was 7 grams per day. The typical American or Western diet provides 1 gram per day. So therefore, if we were to estimate physiologic requirements based on historical provisions, we could reasonably state that most people need to consume more omega-3 fatty acids, and that is clearly borne out in the clinical research using those fatty acids. Typical dose of GLA starts at 500 milligrams per day. Typical dose of EPA and DHA is approximately 2 grams per day at least. I've published some major reviews on this back in 2004, 2005, and you can access those articles from my website. Again, the health-promoting fatty acids ALA, GLA, EPA, DHA, and oleic acid from olive oil have consistently shown proven anti-inflammatory and clinical benefits in randomized placebo-controlled trials. The molecular mechanisms of what I call combination fatty acid therapy include the following: precursor competition in cell membranes, activation of PPAR gamma and PPAR alpha, otherwise known as fatty acid receptors. Also nutrigenomic effects, modulation of gene transcription via downregulation of NF-kappa B, which I've discussed previously and I'll continue to discuss as kind of a common theme or common inflammatory pathway throughout this presentation. Those anti-inflammatory fatty acids affect their biological functions through their conversion to docosahexaenes, resolvins, protectants, and maresins. These are active in the healing process and provide also anti-inflammatory benefits. These fatty acids also provide reduction in hypothalamic inflammation by modulation of toll-like receptor 4. They also help to induce the T regulatory cells through several different mechanisms, including the activation of PPAR gamma by gamma-linolenic acid. Also anti-inflammatory, anti-hyperlipidemic, and anti-diabetic benefits through the activation of GPR 120. These fatty acids also provide improved cell membrane dynamics and function, and we know that many receptors are on the surface of cell membranes. So when we improve the components of that cell membrane, we improve the function, for example, hormone reception and intercellular communication. Omega-3 fatty acids optimize not simply the cell membranes, but also the membranes of the mitochondria. So in that way, omega-3 fatty acids actually help to improve and support mitochondrial function. Omega-3 fatty acids also support improved neurotransmitter synthesis and